So we also get the question very frequently, I think I've been exposed. What do I do? So two things. One is the cases we've identified are very, very isolated, and sometimes and typically this is what we've seen too, is that it spreads in close contacts. So family contacts, household contacts, and that's mostly what we've seen. So that's actually reassuring, at least for now. And so it doesn't mean that if somebody is coughing next to you that you have been exposed to COVID-19. Remember, this is the winter months and the respiratory season is full on. And so that every year we see this. We have influenza, we have RSV, we have parainfluenza, we've got the common cold. Tons of viruses circulate that give very similar symptoms. So the cough, the red eyes, the runny nose, the fever, all these kinds of things. And so it's not because somebody is coughing that they have COVID-19. So that's the first thing. Now, it is possible that you may have been exposed, in particular if you have traveled to China, Hubei in particular, and now the other countries that are starting to appear. So Northern Italy, Singapore, Japan, Iran for sure. And so if you have traveled there, it is possible that you have been exposed to the virus. So what do you do? So from these high-risk countries, we ask people to self-isolate, or actually we should say self-quarantine. You're not sick, you've just potentially been exposed. And so what we do is, just in case, you can be excluded or away from others in case you develop symptoms. And if you do, then you won't be exposing others in the early days. So when you travel back from those countries, you would be told and given instructions to self-quarantine or isolate yourself at home to not expose others in the eventuality that you would develop symptoms. So it would be told very clearly, you would have those instructions, and somebody would be in touch, and you could contact 811 for more information. If you are in contact with a case, one of the cases we have identified in Fraser Health, you would know about it because we are tracing all the contacts and working with those contacts to instruct, give recommendations and guidance in terms of what to do, what not to do to prevent the spread, and if needed, to test. So usually contacts are asymptomatic, so we don't test somebody who is asymptomatic. And if you develop any symptoms that are respiratory in nature, then we can certainly test you if you've been in contact, let's say, with one of our cases, and then we would go from there. It doesn't mean that because you think you've been exposed to one of our cases that you are infected, but it is possible. And we can test if you develop symptoms and then go from there and manage you as a case, or clear you completely and say, well, you've got something else. So we have ways to do that, and we have identified all the contacts in BC so far of the few cases that we've identified. So if you have not been reached out to and identified as a potential contact, you are not a contact of those cases.